Alcohol puts a heavy burden on EU population. Alcohol is known to contribute to over 200 health conditions. Alcohol-related deaths account for around a quarter of all deaths in young men. However, alcohol-related harm is not only a health issue, it also causes remarkable economic loss. A major part of it comes from crime, violence, reduced ability to work, and other social costs. According to the World Health Organization, the most cost-effective measures in alcohol policy are raising prices, reducing availability, and limiting marketing. Health policy remains under the jurisdiction of member states. But what can one country actually do alone? Let's suppose one country raises alcohol excise duty to increase prices. Consumption falls and health improves, but not as much as expected. Cheaper alcohol may then be brought in from neighboring countries. We see this happening on several borders. What about marketing? There are less and less borders in the digital world, and we enjoy it, as well as all the digital ads. At least you can raise awareness, right? However, unlike with food products, EU regulation does not obligate alcohol producers to list ingredients and nutritional information. Hence, the efforts of member states can be diluted by exposure to cross-border issues. Enhanced cooperation between member states could bring better results. We consider the health of people living in Europe the key factor for the economic success and the well-being of society. Therefore, the Estonian Presidency calls on the EU health ministers to discuss the cross-border aspects of reducing alcohol-related harm in Europe. On the 21st of July, at the informal meeting of health ministers in Tallinn, and at the formal meeting of health ministers in December, cross-border aspects of alcohol policy will also be discussed at a conference in October.